think it's a situation where big cases don't come and just land on your lap every single day. You will get a reputation for good dentistry, and good dentistry will all of a sudden translate into the type of dentistry you want to do, if that is big cases or sleep or implants or something else. So I feel like starting with that without leading up to that might be setting you up for a lot of frustrations.
Hey everybody, welcome back to another episode of Gloves Off. I'm David Rice, your chief editor here at DentistryIQ, and we have a very special three-part series with a very special guest.
Hey everybody, Pam Maragliano-Muniz. I'm so excited to finally be on Gloves Off.
It's like a long time in the making and well overdue, but this is like the perfect topic I love for us to talk about, Pam, and that's big case dentistry. And I think for today, part one, like, why not to focus on that in a dental practice?
I think it's a situation where big cases don't come and just land on your lap every single day. You will get a reputation for good dentistry, and good dentistry will all of a sudden translate into the type of dentistry you want to do, if that is big cases or sleep or implants or something else. So I feel like starting with that without leading up to that might be setting you up for a lot of frustration. So I would say one of the best things you can do, which is a great lead into a big case, would be occlusion, plane of occlusion, where teeth should be in relation to the face, smile design, tooth proportion, dental materials. You can get all of these fundamentals with smaller cases so that when the big case rolls around, you feel prepared to do it.
I love that. And what about like the whole wellness and prevention side that sometimes I think if we overly focus on big cases when we're not quite ready for it with the preparation you just mentioned, like it gets lost.
I totally agree. So let's talk about this. You, David Rice, you need to get some dentistry done. Do you want all of your teeth prepped in your mouth? Like, is that what you want? Like, do you want to sit there and spend thousands and thousands of dollars and hours horizontal in a dental chair? Is that something that you would look forward to doing?
You know, I didn't have that on my wish list for this year, so no.
No. And I would say most patients aren't looking for that either when they could be treated via minimal intervention. So there's always a time and a place for maximal intervention. But if you can prevent somebody from getting to that point or stretch out the lifespan of their teeth, why not do it? I feel like for me, I love to preserve tooth structure. So if I, for example, am seeing a kid, the older I get, the younger they seem, a kid with, say, peg laterals, I'd rather start them at 15, 16, whatever years old in composite, knowing someday down the road, they're probably going to want to transition to porcelain. But I've at least saved myself the tooth structure so that when I want to do that down the road, the tooth structure is there. If you started with a crown or a veneer or something like that at 12, 13 years old, and now this restoration needs to be replaced, we all know the tooth cycle of life. That tooth will be an implant someday.
True story. Friends, dentistry begets dentistry. No matter how good we are, it's going to need to be redone at least one, two times in somebody's lifetime, especially in that peg lateral case when we start treating somebody when they're a wee lad or laddess. I don't know. That's not a word, but it is today. So conservation of tooth structure, bank it, keep it. Final thoughts, Pam. I know we're going to come back next time and talk about like, okay, so big case dentistry when we need to do it.
Absolutely. So I would say treat your patients like you would treat your best friend or like you'd want to be treated yourself. Usually that starts with minimal intervention and also treating the problem. Don't treat an orthodontic problem with restorative dentistry. Don't treat, so I feel like it's one of those things that appropriate treatment planning will help you achieve a minimally invasive approach.
I love it. All right, gang. We'll see you next time here at Gloves Off. Pam, you're the best.
Bye, everyone.